Great. Well, let's move on a little bit. So, we talked about the challenges we all face given the pandemic and the need to have physical distancing. But for folks that are challenged with mental health challenges, um, this could maybe exacerbate that. And then there are folks that maybe a lot of folks I'm hearing are reevaluating life and priorities. And there may be some people thinking about beginning recovery, and then there are those out there that are trying to maintain their recovery. What are some of the unique challenges that those folks are facing?
Isolation certainly with this pandemic hasn't been easy for any of us. It certainly, I'm a known extrovert, and can tell you that being in social isolation is not easy for me to do in any means. But you're asking a group of people who have substance use disorders. One of the things that we know about their recovery is their support system. And we've known that for many, many years. We've known that Alcoholics Anonymous and Narcotics Anonymous, all of those fellowships have really been not the treatment component, but the recovery component, the quality of life, when I'm having that bad day or I'm having the thoughts of a relapse or any of that, it is being able to go to a meeting and reach out to your sponsor. And so when we started this whole piece of that we need to, for our health, to social isolate, we were taking a key piece of where they find their support system. And whether that was a day in recovery or 25 years in recovery, when you're used to daily or monthly or weekly talking and being with people who totally understand where you're going and why you've been, we're asking a great deal, and the risk of relapse increases. And then you have a huge population, and the people in recovery will tell you that the people they're really worried about is that newcomer, is that person who decides, do I need to really look at what I'm going? Is this really to the point where I need help and assistance? And when we close doors or they're not welcome, or they don't, not that they don't feel welcome, it's just really hard to do that. So if we use the example of, it's been wonderful for the recovery community to do all this social networking thing with Zoom. So you'll find places like the Bangor Area Recovery Network Barn or the Portland Community Recovery Center all doing this virtual meetings and Zoom and all that. And there's people who already know each other connecting on those Zooms. And although it's not the perfect thing, they'd rather be at a meeting and being together, it works. But when you talk about somebody who has no connection to those 12 faces on that Zoom board, it's really hard to say and reach out, I need help. And we really worry about those, what we call in the program a newcomer, or someone just for the first time seeking help. And we don't want to lose them because we know that in Maine, we have too many people dying. And not only do we have people dying from opiate overdoses, but we still have people, as we know from Time to Ask, who are dying from alcohol use and abuse. And so we need to figure out a way to connect with them. So again, we've been pretty, wise in what we've done. I know that, for instance, both Portland Recovery Center and the Barn continue to have recovery coaches available. So you can call. You can pick up that phone and call and ask at both centers for recovery coaching. And then they have what they call telephone support in both Barn and the PRCC, the Portland Recovery Community Center. And they can get some individual over the phone support for who they are and what they need and where to go. And that's important for them, to talk to people who have been there, who've done that, and get some help with moving forward. It's been a struggle. I think they're all at this point, we've been at this for about 45 days. And so we're all getting to the point where we all want to go back to meetings. And we were very grateful when the governor and Gordon Smith clarified a little bit about that meetings are essential. The challenge with that is it's 10 people for half an hour at a time. And so that becomes a challenge. But for small rural communities, that may work really well because they have a smaller population and their meeting size may be smaller. So they've been able to connect that in some way. There's also the treatment component of this. So if you're an individual who is really looking to enter treatment maybe for the first, maybe for the second time, whatever that moment is that you need help from a treatment provider. And whether you're somebody who's in recovery and needs a treatment provider because you feel like you're headed towards that relapse or even have relapse, there are still many treatment centers that are still open. Some of them are doing telehealth so that you can practice social distancing, but also some of them are actually still seeing in person, one-on-one, and they are doing some groups of 10 or less, which is within the guidelines. So my recommendation would be for anyone really out there struggling who feels alone and isolated and really needs to talk to somebody and probably needs some treatment is to really call 211. That they have an entire list of people you can call. They also have it by region. So whether you're in Portland or whether you're in Caribou, they can direct you to somebody who's close to home for you and be able to get help there.